Picture this. You have been in the gym working so freaking hard, doing all different kinds of leg day workouts to just start growing some muscle in your lower extremity. All of a sudden, your knees just start hurting so bad. You go back and watch the film and you see that all of your squats and jumping loads, your knees are liking to dive towards midline, and you're like, I wonder what's going on. Well, I'm gonna let you in on a little secret, and it's called having a weak glute med. 3 major roles that your glute med does: abduction and external rotation of your hip, as well as pelvic stability, which is the big factor that we're gonna need to cue in for this exact scenario. So if someone has a really strong glute med, this is the normal type of kinetic body diagram that you're gonna see. This is because the pelvis, which is the triangle in this situation, is getting held up by your glute med in even alignment on top of your lower extremity or your legs. And you can see that the knees on both sides are not having to compensate from one to the other in order to keep your pelvis at neutral and even alignment. So this kinetic chain is showing someone that has a weak glute med, and now you can see that the pelvis is unaligned on top of your lower extremity, and now your knees are taking the load to compensate for this uneven alignment and trying to hold your pelvis in stability while it's also trying to do all those different movements that you're doing in your workouts. And this is exactly why you guys have knee pain. You're making your knees work in planes of motion that they're not designed to do because you're trying to overwork and overload them to compensate for this uneven alignment at your pelvis, all because you have a weak glute med. So let's fix that. 3 exercises to strengthen your glute med: clamshells, fire hydrants, and side-to-side ski walks. So start using these 3 exercises in your next leg day and start watching that medial knee pain go away. Bye.